I feel like there's not many times in life when you can expose yourself to changes in lifestyle, such as, going across the world.
South Africa just seems like a once-in-a-lifetime opportunity that I just couldn't pass up.
I really like talking to people and working with people, so I think being able to form better connections and be more understanding of where they're coming from is going to be huge.
I really want to be able to own my own physical therapy practice. I feel like if I'm going to be owning a practice, I'm going to be dealing with individuals who may not have as much accessibility to appointments as other patients.
I'm just lucky living in America and having the things that I have and being fortunate enough to be on this dialogue.
Dialogue is a health and international medicine dialogue that we go for 30 days in country to South Africa. We try to check out 3 different major cities, Johannesburg, Cape Town, and Durban, and try to look at the healthcare system and look at how does that compare and contrast to the US or potentially the student's home country.
It was really eye-opening to see every kind of crevice of the country. People usually build their own structures out of maybe shipping containers or other found materials to make houses, and there's usually not a major source of running water.
Even driving on the bus too, driving by some of those settlements and some of those towns was really interesting.
I was very shocked at just the blatant inequality. People are really suffering because of it.
It's a level of poverty that they've never ever experienced except for maybe on a movie.
I know it was really hard for some of the people in our group at first because living in America, that's not something we see. But I think it was also important because getting a view of how some people have to deal with healthcare abroad can give you a much better knowledge base.
In Johannesburg, we visited a couple of hospitals. We did both community health centers and big hospitals like your central hospitals. We got to see, quite a lot of traumatic stuff.
What they deem as essential is very different from what we think of as essential at home.
People are really only coming in when they're really sick. I don't know, just the divide between public and private has been kind of crazy to me here.
I think that there is a much wider gap in South Africa, and we got to learn more about that when we actually visited the different hospitals and clinics.
The public hospital we went to, I went to the transplant center, and they told us that they had 7 or so rooms set up, but they said they only have enough resources to have 2 rooms run at a time.
Load shedding is a policy that cuts the electricity for a few hours at a time, several times a day.
So many things are just, not going accordingly because of this load shedding. Hospitals, we get to have a big number of, deaths.
There's so many inequities, especially between the rich and the poor areas, especially those that were created from apartheid that are still true today.
In the Apartheid Museum, we got to learn more about the history and the horrifying aspects of apartheid, and it really helped us to better understand what this country has gone through.
We come from an era of apartheid that was so wrong and so bad that it must not be repeated. I think that's what I'd like the students to be aware of the history, and that the power that they have of choices that they can make.
My philosophy is, I take these words very literally, dialogue of civilizations, that I think that the students should hear from South Africans, hear from people that work in the industry, people that live in South Africa, that are South African, versus sitting and hearing me do lectures.
The thing that surprised me the most was that there are people there with problems 10 times as big as ours, and they're so kind and welcoming to us.
Everybody is so welcoming and excited to talk to us. It was really cool to see that they were excited to learn from us just as much as we were excited to learn from them.
We are warm in heart. We have what we call humanity, which is the spirit of loving each other. And we have got hot food from Indians, so everything is warm. We warm you up in KwaZulu-Natal.
What is interesting about your program is that it's not a typical tourist program. They're at a stage where they are absorbing a lot of information and they're listening. I think that's really great, that they're able to listen.
We also went to spiritual healings, which are very deep in our culture, in our Zulu culture. No one can tell you what is it all about until you experience it.
Even though it's not a huge thing in America, there are people that still use traditional healing in America, and any experience like this, whenever you travel abroad and continue to take the effort to learn about another person's culture, it just allows you to be a better provider back in the States.
All the speakers were so passionate about what they do, and it kind of made me realize that I'm not just interested in the medical side of healthcare, but I'm also interested in the social aspects of healthcare in terms of like socioeconomic status, access to resources and things of that nature. So seeing the passion and like seeing how they can help people just makes me realize that that's absolutely what I want to do.
What I like about this dialogue is that students hopefully get a better understanding of who they are, maybe what they want to do in the healthcare world, but also appreciate what we have. There is ideally in this world, and there's also realistically in this world, and we're getting a realistic look on some things that are uncomfortable, but eye-opening.
I think the way this trip is structured is really nice because as much as it is a lot of learning, it's also like a lot of like actually enjoying the culture and like being part of that.
Exploring with my friends and learning about South African culture is what I really enjoyed the most.
Music is such a big part of the culture here. So in Kliptown, a group of guys gave us a traditional dance performance with drums. Even though it's like something small, it's a great way to just have that community building and like stay together and just a way to bond with like members of your community.
Safari was amazing. We've seen so many elephants like up close and personal. Seeing animals just like in their natural habitat it's like unlike any other experience.
Any animal that you can think of that you find in Africa, you'll definitely find in the Kruger.
Honestly, this whole trip has been like amazing. When you're here and surrounded by like just people with like similar passions and stuff, it can be really like nice.
In this trip, I've been way more myself than I ever have ever.
I think just how grateful I am to have been here and not just seen what everyone usually sees or like the beautiful parts, but instead got to see people who are really struggling and who don't like the system and who the system doesn't cater to.
I thought it was like unlike any other experience I think I'll ever have, and I'm really glad that I am lucky and fortunate that I got to go.
The Northeastern University, just, you know, there's so much that I got to learn also about myself just by being with them, you know, taking out something from me that I didn't even know that existed.
The trip with the students has been wonderful. I saw them appreciating what KwaZulu-Natal had to offer to them. So I really hope they come back.
The goal is that hopefully these students can understand that there's a whole big world out there that they can do a lot of good for. We're fortunate at Northeastern to have very bright students who are very motivated to make some change.